With more than 39 million prescriptions filled in 2020 alone, amoxicillin is the most prescribed and some pharmacists believe over-prescribed antibiotic in the United States. Right now, it's one of more than 200 drugs experiencing a nationwide shortage, and many of those drugs are lifesavers. In this week's in-depth conversation with moderator Reese Wetzel, we'll learn more about what's causing the problems and if we can expect to see improvement in 2023.
Thank you, Rich. We have two guests here today who can give us some insight on this ongoing drug shortage that's impacting the nation, and not only the nation, Oklahoma as well. We have two experts here. We have Brent Alexander, the pharmacist owner at Sooner Pharmacy in Norman. And then we have Senator Carrie Hicks, the Democrat senator from Oklahoma City. How are you guys doing today?
I'm doing well. Thank you so much for having me.
Good.
Yeah, thank you.
We'll jump right in. I know that this has been an ongoing shortage, really has just kept growing as 2022 kind of ended. So I kind of want to get Brent, just get started into how have these drug shortages on medication like Adderall, amoxicillin, Ozempic impacted Oklahomans, and what happens when people need these drugs but they can't get them?
Yeah, I've been practicing pharmacy probably 15 years, and this last year has been the worst I've ever seen. But as far as accessibility, it's very challenging. I've had a lot of patients that haven't filled my pharmacy, just kind of calling around all the way from Oklahoma City and just trying to get creative. And we try to network with other pharmacies that do have some, but often what I've found to be a general trend is that the independent pharmacies tend to have it a little bit later than the corporate chains, only because some of us have smaller secondary suppliers, and we don't, our dispensing timing is a little bit different. So sometimes that can be a good resource for them to look at an independent pharmacy, because we've often seen that case, especially with the amphetamine salts, Adderalls, and those types of medications. So as far as, I don't have a crystal ball answer about exactly how, but getting creative and starting with independent pharmacy, because the general trend has always been that the big corporate chains run out first, and then it kind of goes down a ladder to some of those. So if they can't find it at their local Walgreens or CVS where they feel, they might check with an independent pharmacy, because we sometimes do. So.
Okay, so that's an interesting point. I actually want to kind of touch on. I was going to ask it later, but since you bring it up, I think it's a good time. So independent pharmacies almost deal with it less, and they can get the drug access easier. Is that what you're saying, than the corporate ones like CVS and Walgreens?
Yeah, I mean, some of it has to do with a few reasons. One, the average independent probably fills less prescriptions than your Walmart, your CVS, and Walgreens. Some of that's for marketing and insurance requiring them to go somewhere, and many reasons. But so sometimes our demand is not quite as quick and as heavy as it is for those. And then also the supply side makes a difference again too. Like I use my primary wholesaler as an independent wholesaler that's was family owned for a long time, and they're more regional to this area. And so when they have something on the shelf, since it doesn't move as quick, they often will have that delayed response. Ultimately, all of us get affected by it, and it turns into an issue where nobody can get it.
Senator Hicks, I want to get into kind of why drug shortages are happening. It feels like such a common thing. And I know Brent had said that this is the worst he's seen it. This past year has been the worst he's seen it. Is this still an aftermath of the COVID pandemic? And just why is this becoming more of a common issue?
Yeah, I mean, I think that's a fair assessment. I know that this, has been ongoing in the United States for, 20 years, but just like a lot of things where we knew that there was an issue, it was compounded by the pandemic for a couple of reasons. One of those, I think, is that there's not a lot of transparency about what's on the market and where it is. Even when it's produced and manufactured and you're trying to locate a supplier who has supply, I think that's very frustrating, not only for our pharmacists, but also for our physicians and our providers from the clinical standpoint of wanting to make sure that their patients have access. And so labor shortages continue to wreak havoc on a lot of our supply chains, and our pharmaceutical industry is not immune to that, in that we were seeing still just some drastic shortages in labor force participation. And so I think in light of what we've experienced with the pandemic, that's just really brought a lot of additional challenges in making sure that we have folks who can actually produce the drugs that are necessary in order to keep our population supplied with those necessary medications.
Okay, so from your perspective, it kind of seems like, the ongoing labor shortages, maybe inflation, that's kind of all correlating into this drug shortage.
Absolutely. I mean, I think that's why you're hearing that this is probably the worst, that most independent pharmacies, and I mean, just, pharmacies across the board, physicians, represent a large group of physicians in Oklahoma City who, that's the number one economic engine for Senate District 40 is our hospitals. And so when I talk to physicians on a regular basis, I mean, they're really concerned and worried in that this has become, a continued growing concern. The other thing is that even when we're trying to think about ramping up production, it's not something that can happen overnight. Knowing, that there is an issue or that there is likely a shortage that's continuing to grow. I mean, some of that is in relation to supply and demand, but we also have, a lot of growing environmental concerns. And so, for example, if there's a hurricane that hits a factory and the factory goes offline for a couple of weeks, that's going to interrupt that supply chain. And that's something that we can't always address preemptively.
So Brant, moving forward, I know we had talked about how the drug shortage impacts local pharmacies, but how does it impact when you are talking to your wholesalers? Is it becoming more expensive to buy these drugs when they're in short demand? Is it harder on locally owned businesses to be able to get these drugs?
How a typical pharmaceutical wholesaler will work, whether it's ours or in general, a lot of independents do use smaller, but a lot of them use the large companies, your Cardinal, your McKesson, AmerisourceBergen, those supplies as well. But all of them run on the fundamental principle that if it's a generic, there's multi-source, meaning there's a lot of manufacturers. They'll contract with specific manufacturers. They don't carry every manufacturer. And that's just to get that large bulk price point. So when you do see some of these supplies no longer available and they have to seek it alternatively, often the prices do go up some too. So that can be problematic, not only for a few reasons. One could be if you have patients who don't have prescription insurance, their price will have to go up. And sometimes insurances don't reimburse at that new increased price, and pharmacies lose money every day, especially on those types of situations. We to mitigate some of that, we have multiple wholesalers. We have our primary and we have secondaries that we work with, and it affects our workflow. We have to call multiple wholesalers to try to track some of this down daily, and it gets a little cumbersome, but we do everything we can for our patients, and it is successful to do that because often those secondaries will have different manufacturers maybe than your primary will, but yeah, it's definitely a challenge to have to look through so many different, secondary wholesalers to try to find something that's not only available, but it's also reasonably priced. Because sometimes they're pretty competitive, and sometimes they'll be way different. So,
Senator Hicks, that kind of leads me into where I want to go with this next question here. So we're heading into the new year. We're in 2023 now, which means a new legislative session. What are some of the ways that the legislature can take on these drug shortages and try and help limit price increases? What's a possibility that could happen with this upcoming session?
Yeah, it's definitely a hot topic. I definitely feel like transparency around, where the medications are is definitely a necessary step that we need to take at the legislative approach. I've filed a transparency measure multiple times over the last 4 years and plan to refile that same necessary piece of legislation because I think, at least having that's one piece, to the solution is knowing where the drugs are, how they're being manufactured, and what the supply issues are, in being able to address some of these massive shortages that we're seeing. I also think that, one of the things that we did last year, or it might have been the year before, was on wholesalers and looking at drug compounding and making sure that we do have kind of a nimble environment for pharmacies to be able to, have multiple relationships in order to fill those prescriptions when one manufacturer, one supplier might not have those necessary medications. And, that's definitely not a silver bullet either. I think what we're going to have to do this year through legislative session is to really take a holistic approach and realize, or at least acknowledge, that there are multiple ways to address this specific issue and be willing to do those multiple solutions versus just a one-time shot, which might help a little. But if we take kind of a multi-pronged approach, I really feel like we can help alleviate some of these problems.
Brant, Senator Hicks brought up compounding. So I just wanted to ask real quick, how is the drug shortage impacting compounding pharmacies? The pharmacies, for those that don't know, they manually make all the medicine in the bottle, right? Or they put it all in the bottle one by one, right?
So it does have some impact. Compounding pharmacy in general is just taking the active ingredient and making it into unique dosage form. Sometimes there's a medication that's only available as a tablet. We can make it into a capsule and in various dosage forms, topical, but it can also help mitigate issues like that. A perfect example that I think Senator Hicks talked about that would be helpful is, I follow a community forum on Facebook of a lot of independent pharmacists throughout the whole country, and one of our issues is amoxicillin is a big one, and that's a scary one too, and I suspect that probably a huge part of that is demand because of secondary COVID and flus and colds are really bad season, really. But the point being is that the FDA put out a release that says basically, if you don't have a completely separate benchtop to do these, you can't even do that. So that's problematic. We need regulation. I understand that, but we have to have smart regulation too, to where we can combat those kind of things. But I don't know of many. There's a lot of compounding pharmacies in the country that all they do is compound, and some of them are just not doing it out of fear that they're not doing it in a completely separate workstation they do their other medications. So those are the kind of things we just kind of have to go through one by one and figure out what is not only safe for everybody, but makes sense and that can, so that is a major issue because amoxicillin has become really, really short. And so that's the one that I would like to see some kind of backup approach so we would have that available to us.
So Senator Hicks, I want to move into maybe more of the diabetes side now. I know that personally you are someone who deals with insulin prices due to your son having type 1 diabetes. So when you see drugs like Ozempic that are being used for weight loss now, and that's kind of why we've maybe seen some of these drug shortages in that area, how does that make you feel as someone who has a family member that has diabetes?
I mean, I also have family members who are on Ozempic, and so I think I trust the medical professionals. If that drug is being prescribed to meet a particular condition, I trust that the medical professionals have the best interests of their patients in mind. Again, I think it's about right sizing our, supply and demand. And so we might have too many manufacturers of one drug and not enough of another. And so really trying to, again, have that crystal ball, make those predictions, and again, letting the industry be nimble enough to be able to respond to those kind of market forces, I think is really, really important.
The data is pretty clear. Those drugs work well at losing weight, helping with metabolic syndrome, which is a massive problem in this country. And kudos to the doctors to looking at preventative care, which we need. But the biggest concern and problem I have with the system is not there. It really has to do with insurance companies because there's the exact same product is available as Wegovy, and it's FDA approved for weight loss, but insurances don't cover it. It simply doesn't make a lot of sense to me in that regard. And if you have people shunting them over to an FDA approved product for just type 2 diabetes, it shortens the supply of the people that really need it. So we need to figure out some way to make some market pressure, like price lower on those, or get the insurance companies behind the idea that we have to start practicing better preventative medicine in this country. That's a really, really important piece, and they need to buy into it. And that's the biggest piece to me. We already have that apparatus available, with medication. It's just getting insurance to cover it so we don't disrupt that supply chain for the people that actually already have the condition who need it the most.
Yeah, and that kind of leads me into my final question for you here is when these drugs are in shortages and you have clients that need them, is that going to cause you guys to maybe lose some of those clients just going to other pharmacies to try and find where they can have it?
Sure, absolutely can. Away and from, we've picked up a decent amount of business too on people who just aren't used to using independent pharmacy, and they come to us because of the fact that we have something. And so it's been beneficial more for us than a loss. But yeah, it definitely people are after it because it works well. And then they're also, the amoxicillin is obvious the reason for that. But yeah, it can definitely impact your business. I mean, we've grown quite a bit because of the fact of that we were fortunate enough to have that delay. And then people come in your store and it's a new place and they're like, hey, we like it. So that's been beneficial for us. But yeah, I mean, people are, I'm glad to see at least people are not apathetic about it and not, chase it down, trying to find it and find solutions. So.
Yeah.
And one thing we haven't discussed is, there's a new drug that's going to be entering the market soon for pre-diabetes, and it just received FDA approval. And so I've been obviously watching that with a close eye. My diabetes caucus co-chair also has type 2 diabetes. And so we've been having a lot of conversations around what that looks like or what that means for Oklahomans who carry a lot of risk factors when it comes to the onset of type 2 diabetes. And so I think there's a lot of things that get me excited about what is actually happening with the pharmaceutical industry right now.
We are going to have to finish our time here. And I thank you both for the insight and for the perspective that you guys brought from the legislature perspective, from the local perspective. I think it really creates a good conversation for Oklahomans to know what's going on in the pharmaceutical industry.
Absolutely. Thank you so much. Appreciate it.
Thank you. Appreciate it.